Good morning. Thank you for giving me the opportunity to speak to all of you today. So as introduced, I'm Dr. Brian Burke. I'm a family physician here in Steubenville. I work for Trinity Health System, and I've been back in the area for a little over a year now with my family. So as a couple brief background information. So yes, I'm a graduate Franciscan, 2007, University of Toledo College of Medicine, 2012. Active duty service in the Navy for 7 years. That's where I did my residency, spent some time overseas in Guam, doing full scope family medicine, which included inpatient, outpatient, OB care. During that time and over the last year, I've been ongoing training in multiple methods of natural family planning and restorative reproductive medicine techniques. My wife and I taught for the Couple to Couple League since right after our marriage since about 2009 we've been teaching for them. I'm also trained in the Creighton model. I completed the training out in Omaha over the past year, as well as Neo-Fertility, which is another group out of Ireland that's related to both, uses parts of both the symptothermal method and the Creighton model in their treatment of menstrual issues and irregularities and problems. So in my own practice, I have a very busy practice of treating women who have concerns about their fertility and menstrual cycle and fertility cycle. So I've been working with a lot of different women from around the region and from locally as well for the past year. So it's typical in presentations I give. I have no financial disclosures or conflicts of interest. The objectives for today is to review the female fertility cycle and understand the respective roles of the hormones and their related measurable signs. Understand the basics of charting and interpreting cervical mucus and basal body temperature. Recognize the role of fertility monitoring in addressing health concerns, and then introduce the Chart Neo app. So today we really want to introduce how to chart fertility biomarkers, and we'll talk more about that in a moment. I will not be discussing how to use charting for family planning purposes. So the goal today is not to really talk about how to avoid getting pregnant. It's about how to chart so you understand your body better and really get to know how your fertility is reflective of your health. After today's introduction, you may still need some additional assistance and instruction on how to chart adequately, particularly if some of your signs may be more subtle or more difficult to interpret. Limited amount of time today, and hopefully we'll be able to start offering that more next semester. Okay, so I know Dr. Droski gave a very good introduction to the female reproductive cycle, so I'm going to just do a quick overview so we can link things back together. Just remember we have the uterus, the cervix, the vagina, and the ovaries, the fallopian tubes, all are very important and all have their respective roles to play. Hormonally, so hormones in men, right? Hormones in women. So as Dr. Droski pointed out, with men, it's very straightforward. We don't really have to worry about that too much. It's either working or it's not. With women, it's a lot more complex, a lot more interaction of different hormones and other aspects of their overall health that can influence those hormones as well, and we'll talk more about that. Okay, so just to reiterate, there are 4 critical hormones when we're talking about the reproductive cycle in a woman. There are 2 that come from the brain, and the 2 come from the ovary. 2 from the brain are going to be FSH, follicle stimulating hormone, and luteinizing hormone. From the ovary produces the estrogen and progesterone. So when we're talking about dysfunction, because I know the question was raised earlier, dysfunction in hormones can come from either the brain or from the ovaries or from both. And that could be because of intrinsic issues with those productions or extrinsic factors within a woman's body that are suppressing the ability for those hormones to be produced normally. And so part of what we're trying to do today is help you understand how to track those physical signs so we can see if these hormones are working correctly or not. Again, to put it all together, we could see on the top line, ovarian, the follicle development, maturing, rupturing of ovulation, the development of the corpus luteum, and then the degeneration as right before the period comes on. You see the interplay of the hormones. So again, you have FSH down on the red line here. As that stimulates the follicles to grow. That causes, as the follicle grows, it releases estrogen. Estrogen rises. It stimulates the pituitary gland to release luteinizing hormone, which then causes the mature follicle to rupture. That mature follicle turns into the corpus luteum, and that corpus luteum is then what produces the progesterone. So follicle and estrogen, corpus luteum, and progesterone. If either of those two aspects of the ovarian function are off, those hormones can be off. And we can measure those signs physically to see if those hormones are qualitatively normal or not. Okay, and again, you see on the bottom here, the endometrial histology. This just shows how at the beginning of you have your period, everything sloughs out of the uterus, that lining of the uterus then builds back up in response to estrogen and then stabilizes in response to progesterone. And once progesterone levels drop, then you come back and have your period again. We can look at the cycle in about 3 phases. So you can either look at it in the follicular and luteal phase, so the 2-phase description, which is what we're looking at here. Oops. So first half is follicular, second half is luteal. And when we're talking about kind of fertility and infertility within a cycle, to just have an idea of when are you actually fertile, we can describe it in about 3 phases, where phase 1 is the time right after the period, menstruation, where it's a time of infertility. All the hormones are low, the follicle is maturing, there's no ovulation occurring. Once you start producing cervical mucus and you're getting close to ovulation, a woman becomes fertile. And she's fertile for about 5 to 7 days or so, given the timing of the certain quality of cervical mucus and timing of ovulation. But once ovulation occurs, then a woman is infertile again. So that's where we're looking at this interplay of the hormones and recognizing that for a woman who is trying to get pregnant, it's actually kind of a narrow window in which she needs to be aware of when she's actually fertile. And so starting to have an understanding of that now and recognizing normal, abnormal can be very beneficial, because as you move forward in life and you enter in the relationship and preparing for marriage and family, having addressed these things now can be very beneficial. So that's one less stress as you're entering into that phase of life. Okay, so again, just a quick review. Phase 1, progesterone drops, start of menstrual flow. Phase 2, which is a time of fertility, occurs as the FSH is stimulating the eggs to develop, which then the follicles produce the estrogen. Estrogen then produces the cervical mucus, and then the LH is released that stimulates ovulation. And in this time that any genital contact can result in a pregnancy. And then after ovulation occurs, the corpus luteum produces progesterone. The progesterone causes both that type G mucus, which is an infertile type mucus, and also causes your basal body temperature to rise. Okay, and we'll talk about that in a moment as a marker. Okay, so let's talk about identifying the measurable signs of hormonal interactions. So these are signs that can be observed and recorded on a chart in an app. We'll talk about different options, but there's 3 big ones we can chart. We're going to talk about the first 2 today. So cervical mucus, basal body temperature, and changes in the cervix itself. So cervical mucus appears in response to estrogen. It's a natural fluid. It's an aid to fertility. So it becomes the swimming medium and nutrients for sperm. And sperm can survive in good quality cervical mucus for up to 5 days. So it's very important to recognize that some of you may have experienced, through different times of your monthly cycle, that you have a discharge that's, outside of, but it comes on a regular basis. That's a natural fluid. And what we're talking about today are all natural fluids and natural markers of the body, and something that we should be very comfortable with in terms of as we get to know our bodies. Cervical mucus also filters against abnormal sperm migration. So again, as Dr. Drosky pointed out, cervical mucus is going to be very critical to fertility. And it's also critical, and it plays a role for both the male and female components. Okay, so when we talk about identifying mucus, cervical mucus, there are 2 things we need to be thinking about. By what you feel and sense, which is the sensations, and by what you see and you touch, which are the characteristics. It's important to note that it really takes 8 times more mucus to see it than to sense it. When we talk about sensing it, we're talking about what you feel around the vulva and down, in the vaginal area when you're walking or you're sitting, that dampness, that wetness that can occur. So when we talk about sensations, this is by what you feel and you sense. You have to have an awareness throughout the day, an awareness when you wipe when using the toilet. And so as you become aware of the absence and presence of mucus sensations, you do this, like I said, throughout the daytime. When wiping, you want to pay attention to this, really starting about the 5th day after your period starts, because you're going to be just monitoring through. So it's important that you start have that bodily awareness of what you're feeling, and recognizing that that's normal, and that's part of your body's response to estrogen. When we talk about recording and charting, basically we talk about, are you feeling dry? Are you feeling moist? Or are you feeling wet? Because as the estrogen levels increase and the cervical mucus becomes kind of more fertile, closer to ovulation, you're going to have typically have a progression where you go from a dry sensation to maybe slightly damp or moist sensation, and then a very wet feeling, and maybe and when you're recording your fertility signs in an app or on a chart, you're always going to record the most fertile signs, which, like I said, is you have that progression. Dry is infertile, moist is less fertile, and wetness is going to be very fertile. The other thing is when you're wiping, so as you take the tissue, typically we recommend an unscented, just white tissue, and you're wiping across the vulva and the perineum. What do you feel? Does it feel dry and scratchy, or does it feel slippery? Does it feel lubricative? Does the tissue just slide right over? How does it feel, both in sense of when wiping and the sensations across that area of your body? So typically we talk about a dry sensation or a slippery sensation when we're talking about sensations with wiping. So when we're recording, so this is a part of a couple to couple leagues chart. This is where we chart our mucus sign. This just shows a progression where we have, in terms of sensations, dry days progressing to a moist days, progressing to the wet days, and the wet and slippery, and then we start to dry back up. Okay, and this is a typical progression. We see the estrogen level is rising, the cervical mucus production is increasing and changing from a less fertile to a more fertile. Okay, so characteristics. This is what we see and what we touch. Okay, so when you wipe and you see nothing, there's nothing there, right? Sometimes you start to have mucus that's tacky, kind of gummy, pasty, doesn't really stretch a whole lot, can be thick, maybe a little cloudy. And then it can progress to being more stretchy, more like egg white. So if you touch it off the tissue paper or between your fingers, you'll have a stretch to it, as opposed to the tacky mucus, which typically breaks at you try to stretch it and just kind of clumps or breaks very easily. When you're observing mucus characteristics, you want to check for what you can see and or touch at every bathroom visit, so throughout the daytime, because you might in the morning not have any mucus sensations or characteristics, and then by that night start to have the production of mucus. So you want to be checking throughout the daytime, and that also creates that habit of every time you're using the bathroom, you're checking to make sure there's nothing there, or if there is, what you're seeing. As we talked about, you don't necessarily check while you're on your heavy flow of period, but as the period starts to lessen, or you hit cycle day 5, we really encourage women to start monitoring at that point in time. So when we're talking about characteristics, we typically talk about there's nothing on the toilet paper. It's kind of tacky, which is that short, gummy, doesn't stretch very much, or stretchy, where it's very, can be very kind of slippery and stretches quite a bit between your fingers. So we're going to overlay the characteristics with the sensations so you can help see the progression. So again, typically when you're dry sensations, you're not going to see a whole lot on the toilet paper. So you have that nothing there. As you start to feel a little bit more moist or damp, you might have some tacky mucus. Sometimes it can be kind of gummy or pasty as well. And then that progresses to more that stretchy mucus that's going to be correlating to the sense of wetness or slippery when wiping. And then again, it starts to dry back up after ovulation occurs. Okay, so now we'll come back to some of this in a moment with the mucus, but I want to talk about basal body temperature because it'll help understand the whole physiology of what's going on here. So basal body temperature is the temperature that you take of your body first thing in the morning before you get up and go, eat breakfast, use the bathroom, do anything. So you've been asleep for several hours, and then that gives you a baseline temperature of where your body is. What we know is that your body temperature actually rises in response to the rise in progesterone. So it goes up about a half a degree. The progesterone goes into your brain, triggers the hypothalamus, and that resets your body temperature up about a half a degree while progesterone is present in the body. And why that's important is because it's a marker of ovulation. So here you can see this is a basal body chart. You can see how there's on the first half of the cycle, there's one level of temperature, and in the second half of the cycle, the temperature actually goes up. This is called a biphasic temperature. Let's see. All right, so we're going to come into how do we actually interpret these signs and how do they all come together, okay? So the absence of sensations and characteristics in terms of cervical mucus typically means infertility, while the presence of any sensations or characteristics usually indicates fertility. And we talk about less fertile and more fertile type signs. The less fertile mucus earlier on when the estrogen levels are first starting to stimulate the body and the follicle is still developing, usually is going to have moist sensations, tacky characteristics, but knowing that any presence of cervical mucus indicates fertility. The more fertile mucus, which means that you're getting closer to ovulation, is going to be a wet sensation, slippery sensations, or stretchy characteristics when you're monitoring your cervical mucus. So when in the symptothermal chart, we typically use these different signs to help indicate the different types of mucus, fertility, so no mucus, less fertile, more fertile, and you can see the corresponding letters over there in terms of how we would chart that. So we look at the chart, and again, this is to help visualize where ovulation is occurring. Because when we talk about your cycle, a lot of doctors focus, and a lot of just general health practitioners and women in general focus on their periods. And periods are important because they tell us a lot about what's going on with the body and some of the hormones. But the period, honestly, is not the key to your fertility cycle. The key to your fertility cycle is ovulation. So if ovulation is not occurring, there's some significant dysfunction going on. If ovulation is not occurring appropriately, then that can lead to hormonal issues or be reflective of hormonal issues as well. So being able to know when ovulation is occurring and what that looks like in terms of the surrounding biomarkers and fertility signs is probably the central aspect to knowing what's going on with your body. And really is in terms of family planning in the future, but right now, that's to know what's going on with your body, you need to know if you're ovulating or not. Because plenty of women will have recurrent bleeding episodes that are not associated with ovulation, but they think they're ovulating or think they're having normal cycles. But if you're not tracking that, we don't actually know. So when I have women come to me in my office, they can tell me, oh, this is when my period's going on, but my real question is, when are you ovulating? And is your ovulation occurring at the appropriate time in relation to those periods, or is they too close together? So this chart helps to visualize how, when we look at the mucus and you look at the temperature, we have the increase in sensations and characteristics from that no fertility to less fertile to more fertile to create, then starting to dry back up. And you can see how the symbols help to visualize that. And you can see right around the same time that we reach our peak fertility in our mucus, that's when our temperature goes up. Okay? So that helps us to mark that here is where ovulation is actually occurring. Okay. So I mentioned the word peak. So I want to talk about peak day, because this is when almost every method that you use will talk about peak day in terms of charting. And whether you're using the Chart Neo app, using Creighton, Symptothermal, we all want to know when peak day is, because that's how we are able to determine when, peak day correlates to ovulation. So ovulation typically will occur within plus or minus 2 days of peak day on a fertility chart. So we're looking for the last day of the more fertile type mucus before drying up begins. That's how we define peak day. It can only be done in retrospect. Okay? So on this chart, which day, based on what we've been talking about the last few minutes, would be our peak day? Now, it might be a little tough to see, but anybody tell? So if you look at day 14, right? We have that wet and slippery sensations, and then it starts to dry up. And that also corresponds to our temperature rise. So that's where peak day is. That's how we would define peak day. Last day of the more fertile type mucus before the drying up process begins. How about on this chart? Is anybody able to give a guess at where peak day on this chart might be? Does that help? What do we think? Day 15, right. So, another one. What do you think? 16? Almost. So day 18, because we still have that wet sensation, okay? Slippery and wet are both going to be fertile. You don't have to necessarily have both slippery and wet, but slippery or wet sensations are going to be indicative of a fertile type. And then, but it's also, where does that drying up process begin? So even if you thought day 16, well, you're still having wet, because you're looking at your characteristics, you're not really seeing anything. But remember, it takes more mucus to see it than it does to sense it. So you got to be, when do we start having that full drying up process begin? All right, one more. What do you think? I'm sorry? 19, correct. So, good. So it starts to become fairly, okay, that makes sense. The challenging part is going to when you're actually charting your personal mucus symptoms, signs, is like, was this peak type mucus? And it takes time for you to learn. Every woman is a little bit different. And when she's got it, and you have to take time to learn your own body and know, okay, this is one type of mucus that's changing into the more fertile type of mucus. Oh, then it's drying back up. And as over time, and as you start charting that more and more, then you become more aware of those subtle differences that occur. So a lot of methods will give you very specific, like, here's this, this, and this. But it does take some interpretation of taking those markers, of how those definitions, and how do they apply to your own physiology and your own signs, and where they fall into place. And that's why I say you may require some additional assistance, as you go through this time and in the future, particularly if you're looking to start using this as a family planning method in the future. Highly, highly strongly recommend that you work with a group or an instructor for further details. Okay, so interpreting the temperature science. We mentioned that cycles have 2 temperature levels, the low prior to ovulation, higher after ovulation. When we see that shift, that means that ovulation has already occurred, okay? So we can see how this progresses through, and we start to see it go up. So peak days on day 14, we see that temperature rising after peak day, around peak day. In order to know for sure that you're having that temperature shift, we typically look at the previous 6 temperatures around the peak day of mucus. We call that the pre-shift 6, and that creates our baseline low temperature level. Some people in other methods would be called the cover line, but that gives us, okay, here's our pre-ovulatory line. They typically use the highest temperature of that was pre-shift 6. And then we add 0.4 degrees to get that high temperature line because, as I said, the body's basal body temperature will go up about half a degree. So we want to be able to mark that, say, okay, did we have an adequate rise in our temperature in response to progesterone? So in this case, again, we see there's the 3 temperatures that are higher around peak day. We look for the previous 6. We get our low temperature line, add that 0.4, high temperature, and we can see how you have that biphasic temperature occurring. And this, again, is a marker that ovulation has already occurred. And why is that important? Because there are women who can have multiple mucus patches throughout their cycle, particularly women who might have irregular cycles. And so this can be helpful to know, was this mucus patch, did I actually ovulate with this mucus patch, and should I be expecting my period in the next 10 to 14 days? Or I have irregular cycles, and so, my temperature didn't rise with this mucus patch. That means I need to be watching for the next mucus patch and the next buildup of estrogen and see if I then ovulate in that time. So having 2 different biomarkers can be beneficial, particularly when you have concerns about irregular cycles or if there's questions if ovulation is actually occurring. Now, I recognize that taking a basal body temperature, living the college lifestyle, can be a little challenging. So I put this out there so you have an understanding that there is another sign that can be very helpful in interpreting fertility and qualitative hormonal levels and responses. There are some newer technology out there, including Temp Drop, which is a wearable thermometer, and that syncs in with like the Chart Neo app and some of the other apps that are being used for charting fertility as well. So there are some newer technology coming out that's making temperature monitoring a lot easier. And this is an oral temperature, by the way. I know we've had that question before. This is just an oral temperature you take every morning before you get up and go out along with your day. Okay. So we talk about, this is just a symptothermal rule for determining timing of ovulation. Ovulation can be confirmed by 3 days of drying up combined with 3 normal post-peak temperatures above the low temperature level. So if you have that drying up process after peak day plus 3 temperatures above the LTL, you can be fairly confident, particularly if they get up to the HTL, that you have ovulated at that point in time. And then you can be expecting your period within the next 10 to 14 days. So again, just another chart to show the progression and how these things line up. So we have the peak day. We have the temperature rise, previous numbers, temperatures. We get our LTL, our HTL, and now we can have relative confidence that ovulation has occurred. Okay, so I know I went through that relatively quickly. Again, this is supposed to be an introduction to charting and to try to get some ideas. And I'll talk about an app that you can be using to continue this fairly easily as you start to get to know and understand a little bit about what's going on. What I want to talk about now is really the role of monitoring in a woman's health. So the varying fertility biomarkers can represent underlying issues. So if we have, as Dr. Dorosky was pointing out, if you have dry cycles or a short luteal phase or irregular bleeding, this can be indicative of a hormonal imbalance. Dry cycles usually means there's poor estrogen production. A short luteal phase, the luteal phase being the time from ovulation or peak day until the onset of your next period, should be 10 to 14 days. That's clockwork, okay? But if that is significantly short, so less than 10 days, or very irregular in terms of its length from cycle to cycle, that can typically indicate that there's a problem with the progesterone levels. Again, so without having to do any blood work, I can get an idea, and you can have an idea, whether or not your estrogen levels are appropriate or your progesterone levels are appropriate. Monitoring your periods and your symptoms related to that can also be very important, because periods really should be, about 5, days or so, have a crescendo, decrescendo, where it's light to heavy, like light, medium to heavy, then tapering back off, or starts heavy and tapering down, and should really be less than 7 days. And so if you're not having that pattern while you're tracking your periods, again, can be indicative of hormonal imbalances or other issues going on, say such as endometriosis, particularly if you're having those killer cramps. So I think it's important to recognize killer cramps. When I say killer cramps, those cramps that lay you up, you can't go to class, you can't work, you've got to stay in your bed for a day or two, and you're not really responding to Motrin or any of the other pain medications. It's not normal. We've been a lot of women have been told, oh, that's just normal, you just have to suck it up, just have to deal with it. It's not normal. And that can be indicative, too, of other underlying issues, whether there's nutritional issues going on, or like I said, I always have a high suspicion for endometriosis in those types of situations, particularly if there's other episodes of pelvic pain throughout the cycle and other symptoms that can be related to inflammation in the abdomen. Irregular or very long cycles. So when I say long cycles, cycles that are greater than 38 days in length, so from one period to the next, those are long. And if they're long or irregular, we get concerned about metabolic issues going on, namely PCOS, polycystic ovarian syndrome. And so being able to start tracking that, you get to start see, do I have normal length cycles? What is my mucus patches looking like in that? Am I having multiple mucus patches or am I dry the whole time? And so those things can help indicate, hey, there's something going on here that needs to be evaluated and addressed. Okay. I think too, so the question was being asked earlier about kind of how what hormones are in play and what dysfunctions can occur. A woman's body is very sensitive to changes in her overall health. And this can be most reflective in her signs of fertility. So, we talked about the progesterone and estrogen, the LH and FSH, and how those have to be functioning correctly in order for these biomarkers and fertility signs to appear. Well, those things can be, in general, functioning normally. But there can be extrinsic factors that come in and influence the production of those hormones, and that then is reflected in your fertility signs and biomarkers. So for instance, a lot of women who are getting close to marriage, their wedding date, will notice their cycles become irregular, or they start skipping a cycle, or their bleeding becomes different, because their stress levels suddenly go way up here. So cortisol, that stress hormone, has a significant impact on your body's ability to produce appropriate fertility hormones. The cortisol goes up, it affects the brain, so it changes the FSH and LH levels. It affects the ovaries, so it affects the follicle's ability to produce estrogen. And when you don't have appropriate follicular development, you don't have appropriate corpus luteum development. And so then your progesterone levels can get off. So everything can be affected by stress. And obviously we know stress comes from lots of different places. But it's really important, and that can also be coming from the same thing that can occur in illnesses, whether it's a chronic illness or an acute illness, can have those same kinds of impacts on the body, namely because your body is suddenly taking all of its resources in trying to address this underlying health condition, which may be completely unrelated to the reproductive system. But because your body is fighting so hard to address this health issue, it's not going to put resources towards hormone production for reproduction. So by tracking these fertility markers, you can have an early indicator of dysfunction in health issues in other parts of the body. Okay, and so and that can be very helpful when you start to say, hey, wow, my periods and my fertility, my mucus cycle, my luteal phase, all these are starting to change. They're not starting to look as normal as they were. If you go to a doctor like myself who's trained in these types of methods, we can say, oh yes, we need to be checking. Let's first check these hormones and check these labs, and then that can help lead to diagnosis of other things. A classic one is thyroid disorder. Okay, hypothyroidism. A lot of us probably know somebody or have heard of somebody who has poor thyroid function and has to take medication for that. Well, thyroid is critical to a functioning reproductive system. So when I have somebody coming into me with irregular cycles or fertility concerns, the first thing I'm doing, along with some other labs, though, is I'm always checking their thyroid function. But you don't always necessarily are going to see all the other signs of hypothyroidism or thyroid dysfunction, such as constipation, weight gain, fatigue, hair loss. You might actually see the first signs of that in your fertility tracking. And that goes for a lot of different other illnesses that are, again, not particularly related to the reproductive system. And when you start to see these dysfunctions occurring, sometimes it requires an extensive workup, extensive treatment, and maybe even surgery, when we start to see these dysfunctions. But sometimes it's just as basic as nutrition. Particularly college, our sleep is a little different. Nutrition isn't as great because you guys are really busy with classes and all the activities. It's just not the same as it was when you're home and mom's cooking good food for you all the time. It's there, right? And as you get older, your body, as you're coming out of adolescence into adulthood, and your hormones and your growth are still occurring, your body still needs a lot of good nutrition and in order for that maturity to occur. But unfortunately, a lot of our foods and things don't have the same value that they used to and don't support the bodies like they used to. So a lot of women really just need some basic nutrition support in order to help regulate their abnormal fertility signs. Okay. I do want to talk a little bit about the Chart Neo app. This is the app that was mentioned by Gabby. It's a newer app out last couple of years. It takes really the components of like Creighton, takes the symptothermal, the Billings method, some of these different methods that are very well used, and really kind of puts a lot of those aspects into a single app. And allows you to, track both your sensations and your characteristics. Allows you to do your basal body temperature if you want to do that, along with keeping track of any medications and vitamins you're on, as well as any other symptoms. So, Gabby had mentioned PMS, so you're able to track some of those, cramps and PMS symptoms and different things in the app itself each day that you're tracking. So I encourage you to, if you're interested in starting to track your fertility signs, this is a great app to use. It's probably the most reliable one I've seen and the easiest to access, and you can do it both offline and online. And what's also nice, I have a number of patients who are using this app where I'm able to connect with them and review their charts remotely through the web portal. It has a 45-day free trial, and then after that, it's $10 for the year. So it's very cost-effective, too, in that sense. I gave a presentation last year on this. You have to be careful about what fertility apps you're using, okay? There's a lot we call femtech, it's a booming industry. And if you go on and start looking at the different apps, there are all kinds of apps. But tell you what, the majority of those apps you'll find for tracking your fertility biomarkers really aren't, they're geared on the old rhythm method, counting days. Okay, if your period's here, and your period's here, okay, this is when you're ovulating. You're not actually inputting a lot of your fertility signs. Now, there are some good apps out there. You can definitely get, like Kindara is another one. There's definitely some ones out there. But in general, a lot of them are just period trackers. So as you are exploring that and trying to figure out what you want to use to keep track of your fertility markers, please keep that in mind and make sure that look at the different apps and see what they're based on. Are they based on an actual method? And when I talk about actual methods, I'm talking about Billings, Creighton, symptothermal, an actual natural family planning method that is rooted in science and research. Did want to show, so we talked a lot about the symptothermal coding. This is just to get an idea that it does correlate to the Chart Neo app as well, where you have that same dry, and then pasty gummy in the Chart Neo app is really tacky. You get some. You're going to use 1 and 2 as your how much stretch is there. So there's also, they talk about the wet tissue is really the moist and symptothermal. Vulvar wetness is that same wetness that you would sense in the symptothermal. Slippery is slippery when wiping, and then they talk about a clear mucus as well. So let's see if I can just give. So you can see here's an example of what a Chart Neo app would look like. our chart would look like. And so you can see how round days, let's see. So again, day 12 leading up to day 15, you have your 2, which is 2 centimeter stretch, clear, slippery when wiping, building up to slippery, and then the drying up process occurs. You can see here how this patient had been tracking temperature. You can see that temperature rise, and you see the red line is that cover line, or that same line we were talking about, the low temperature level. And you can see that corresponding rise around peak day that indicates that ovulation has occurred. And then you can see how tracking through, she has a 14-day luteal phase, which is normal, and then that drop in temperature and that drying up process. So this is what a Chart Neo app would look like. Okay, let's see. So where to start today? So download the Chart Neo app is what I recommend, and start charting your fertility signs. Just start following the prompts in the app to see how, be aware of what's going on with your body and start marking it and start getting that practice into play. For those with irregularities or concerns about your fertility cycles and signs, there's some basic supplements that I recommend to my patients, namely Optivite, and specifically Optivite. That can be found on the Cup of the Couple League's website, ccli.org. Omega-3s, so like fish oil or flaxseed oil, they have a significant anti-inflammatory effect and can really help with both painful periods, bleeding issues, as well as ovarian function. Vitamin D, I think just in general, we're all just deficient in vitamin D, and that increasing those levels seems to help. There's evidence that it helps improve ovarian function. I encourage B12, a good B complex for adrenal support. As students, you guys are going through a lot of stress, you're working hard, there's a lot of taxing on your body, and the adrenals are one of the areas that produce all that cortisol and adrenaline and all these different things to help keep you going. As those get fatigued, your body's going to shift resources away from your reproductive cycle and towards trying to keep you going, and that can cause some dysfunction, and it also makes you just not feel great. So encourage B vitamins. And vitamin E as an antioxidant, anti-inflammatory as well. So those are just some basic vitamin supplements that I recommend. The Optivite is probably key. My wife and I, when we tell our story, talk about how we were here at the university, we took a class to the Cup of the Couple League in our engagement. She started charting her signs through the same stuff that we just talked about today, and she started to notice how her cycles were not normal. She had PMS symptoms going on, she had painful periods, the luteal phase wasn't right, and so we were able to find a doctor about an hour or so away to the west who was trained in these methods like I am. We worked with him, he looked over the charts, he talked about what he could do for us, and he made a recommendation to try Optivite. And so we did, and 3 months later, her cycles really started to normalize and improve, and she felt better, I felt better, then after we got married, which wasn't too much longer after that, we were able to successfully conceive our first child without any difficulty and no problems or issues. But we really feel like that without having addressed those concerns before we got to that point, we would have been much higher risk for miscarriage, because we knew that her hormone levels were off in some way. Now, we never did the blood work at that time, so I can't tell you just how off or where it was, but qualitatively, we had an idea that things were not right. And that was just simply through nutrition. And that same thing goes, I've had many patients over the last 8 years who it's a matter of starting to learn your body and then starting to use nutrition, so improving your diet overall, improving your sleep and general health, but also specific vitamin supplementation. And over the course of usually about 3 months or so, that's where we have improvement. And sometimes that's all I have to do. Other times there's additional treatment and support that has to be done as well. In fact, this past spring, I had a patient who called in COVID hit. It really disrupted a lot of things in terms of patient care. So she was supposed to see me in March. We kind of shut things down and pushed her back for about 3 months. But I talked to her. I said, okay, what's your concern? I said, oh, here, I'll send you an email with my nutrition supplementation recommendations. She came to see me 3 months later, and that same week that she saw me, she had a positive pregnancy test. And her goal was to get pregnant. And that's all we did. It was just change that for her. And this is after 2 years of infertility for her. And so now I'm managing her, I'm helping with her pregnancy, monitoring her hormone levels, her progesterone levels, and things like that through the pregnancy. But I didn't even get a chance to do any of that beforehand. She just started charting, saw that there's some issues going on. We did some nutrition support, and now she is 28 weeks pregnant. So, with a healthy pregnancy so far. So again, and those are stories that, that obviously it's anecdotal, but I have enough anecdotal stories from my own practice to say, hey, this is a really important area to be thinking about and to looking into, and recognize that how you're sleeping, how you're eating, exercise, all these things have an impact on your general fertility, your general health, and then specifically your fertility, and how your fertility can be a reflection of how those things can be out of order.